This is Dr. Jonathan Leibowitz at Leibowitz Plastic Surgery, located in Huntington, Long Island, New York. And I just completed a case of puffy nipples, gynecomastia on a young man. We took on both sides this gynecomastia, which is a hard, fibrous tissue from underneath the nipples. And you can imagine this sitting underneath the nipples, raising it up. So I simulated a glove. I cut a little glove and drawn a little like nipple areola area, and you can kind of see when I press down on it how the puffiness, if this is the chest and this is how the puffiness is caused by this gland, gynecomastia, underneath the nipple itself. So as I said, I make a little incision from about the 3 to 9 o'clock position, sometimes a little bit smaller from 4 to 8 o'clock position. So I cut into it and able to actually cut at the edge of the nipple, almost where the beach, the water meets the beach, so it really heals inconspicuously. And I pop the gland out. So when this is removed, the nipple is then perfectly flat. Guys just don't want this in their body. It's hard, you can't liposuction it. And as a matter of fact, through my scissors, let me show you when I cut this, how hard it is. And you can't, if you imagine trying to liposuction this, you can't. And guys just hate this. They have a great figure, they spend hours in the gym, they eat right, eat clean, but they have this hard, fibrous tissue underneath their nipples, and that really bothers them, and it causes distress, and you can kind of see how hard this is. In guys that have a little excess fat, we liposuction around it, kind of contour the chest, but males always have breast tissue. They always have breast tissue, and this is what it is. It's important for them to see this, and sometimes I actually give it to them with gloved hands to actually touch it and feel it, because it's kind of like a closure. They spent so much aggravation and time thinking about this since puberty, since 12, 13, 14 years old, and they finally come to me either in late teenage years or early 20s to get this done. And it's a simple operation under local in my office operating room. They drive themselves home, they drive themselves here, and it's a relatively easy operation. The scar that they have heals great, and you get perfect results within weeks. All self-absorbing stitches, and they can go back to the gym about 2 weeks later, and the guys just are so relieved that it's getting done, and they have closure because this stuff is out of them. Anyway, this is Dr. Jonathan Leibowitz at Leibowitz Plastic Surgery, showing the gynecomastia gland tissue and how hard and fibrous it is. Any questions about gynecomastia or other plastic surgical procedures, please call my office at 631-424-0101. Thank you.